Good day, and thank you all for joining me once again as we hop over into the Clinical Specialties title. Once again, we'll go ahead and explore some of the more niche content available through this title by taking a look at some of the gross anatomy specific to the profession of otolaryngology. Kicking things off, we'll go ahead and hop over into otolaryngology. Now, for those of you who aren't familiar with this particular subdiscipline, otolaryngology involves the assessment, diagnosis, as well as treatment for various diseases and conditions associated with both the ear, nose, and throat. Now, these individuals are often referred to as ENT surgeons. And before we go ahead and jump over into some of the content, for those of you who are familiar with either the anatomy and physiology title, as well as 3D Atlas, may seem quite familiar with some of these different menu options. Let's go ahead and jump over into the first option, taking a look at some of those 3D views. This first teaches you all the associated gross anatomy to those various regions. And once again, we have our interactive 3D model with those various rollover labels, and for any structure that we do select, it'll then highlight that associated structure and provide us with some explanatory information about both its origin, insertion, blood supply, as well as innervation. Now, additionally, we'll then also be greeted with some information for these various structures about any important landmarks that could be beneficial to our ENT surgeons in relation to various diseases and conditions when performing those all-important surgical procedures. Let's go ahead and jump over into the second part of the otolaryngology title by taking a look at some of those different image modalities. Over here, we have an interactive 3D model alongside an axial model for the head MRI. For any structure that we do highlight over on either our interactive 3D model or our head MRI, it'll then highlight that associated structure on both models and provide us with the associated explanatory text for that particular structure. Now we can then move through different layers of anatomy to take a look at some of those different pieces of anatomy that is quite crucial to this particular subdiscipline. And we're then also able to take a look at the exact level at which we are interacting with those different pieces of anatomy. Now let's go ahead and jump over into the third menu option, where we'll have some various anatomical and developmental slides, as well as the all-important dissection content, those various clinical slides, as well as some still head MRI images. And let's go ahead and take a look at some of those still head MRI images firstly. Now once again, these images are still fully interactive, and you'll be provided with the associated explanatory information. For those anatomical as well as developmental illustrations, these will provide you with some detailed and labeled slides, which can then be used to better visualize those various, often abstract physiological processes. Now, understandably, embryology is a subject that can be quite difficult for students to often grasp, and being able to visualize these different abstract physiological processes using a more two-dimensional aspect can be quite beneficial. Next, let's go ahead and jump over into the all-important dissection content. We then have various dissection slides, which helps create a more realistic impression about what you would typically see when engaging with cadaveric content. And once again, with each of these different dissection models, or in this case dissection content, each of those various structures that we do select are interactive and will be provided with the associated explanatory text. Now let's go ahead and jump over into some of the more clinical style information. And this is where we have those various clinical slides. Now if we go ahead and select a parodectomy, what we get is a 2D representation about this particular procedure, as well as the associated steps involved when performing this particular procedure, as well as any important associated piece of surgical anatomy that would be engaged with when performing this particular procedure. We then have those various clinical videos as well as associated movement animations as well as the surface anatomy movies. Now, starting things off with those different surface anatomy videos, this just helps showcase some of the gross motor movements about those various associated muscles. And then we have the clinical videos. Now, this has been nicely broken down into both patient examination as well as various surgical procedures. For our patient information, or in this case patient examination information, this can then be used to help students better visualize some of the various procedures that they will later perform once they are competent and confident practitioners. For each of these different movies, they are narrated, and in this case the clinician will provide you with a full overview about the relevant anatomy associated with this procedure as well as how to perform this particular procedure. Let's go ahead and jump over into some of those different surgical procedures, and considering that we took a look at a paradigmy, we're now able to use the explanatory movie to create a more 3D overview about how to perform this procedure, taking a look at some of the associated anatomy that is involved when performing this procedure. Next, let's go ahead and jump over into some of those different movement animations, and this just helps showcase some of those different actions involved in sound production, or in this case abduction with the larynx, as well as for the mechanisms of swallowing or any movements associated with the eye, TMJ, or in this case the mucosal waves. Nextly, we have some animations showcasing some of the different movements associated for these different muscles. And then we have the clinical text. This has nicely been broken down into 3 different sections, focusing on the developmental processes for the pharyngeal arches, clefts, and pouch, as well as providing you with some explanatory information about the patient examination that we previously took a look at when we took a look at the stroboscopy video. We then also have some explanatory information for those various surgical procedures. And now, as the clinician or surgeon performs the paradigmy, we're able to follow along by using each of these different sections, starting off with the introduction, then taking a look at some of the indications, highlighting some of the all-important surgical anatomy, as well as how to perform the associated operative technique. We then have the anatomical structures, which have been broken down systematically, similarly to what we saw over in the 3D views. And then lastly, we have each of those different menu options, which can commonly be found across both the Atlas, Anatomy and Physiology, as well as various other titles available through Primal Pictures. We have our alphabetical index, the ability to save content which can then be accessed offline at a later time, the ability to share this content simply as a link, the all-important embed function, the ability to save and download this content for offline use, and then lastly we have some menu options which allows you to customize your user interface. Now, I hope you all enjoyed this little crash course about how to navigate the otolaryngology title, where we took a look at some of the more clinical style information, specifically both patient examination as well as those various surgical procedures. I implore you to go ahead and explore some more of the content available through each of these titles as you make learning come alive.